Our wages aren't keeping pace with the increase in healthcare prices. And let's face it, bankruptcy due to medical problems, that is still amongst the top causes for individuals. Now the city council, with a supermajority of members, wants to create the very first ever office in the United States at the municipal level where they force hospitals to reveal those prices and truly be transparent.
Hospitals already federally mandated to have so-called price transparency. But because it's so inefficient, city council members are saying New York needs to do something about it and force those hospitals to come clean and tell us exactly how much something costs. It would allow consumers to price shop in between hospitals. And that, they say, would drive prices down for all of us, as well as for taxpayers paying the costs for city workers' health care. How bad has it gotten? In 2023, New York City is estimated to spend $11 billion annually on health care costs for city workers, 40% of that just for hospital costs. But an analysis showing New York may be overpaying by more than $2 billion if hospital prices reflect what's happening statewide. That's why city council members say we need the Health Care Accountability and Consumer Protection Act. That new bill city council is introducing today would create an office to force hospitals to be truly transparent so patients would know what they're paying ahead of time, could choose another hospital with a better price. A study by patients' rights advocates finding less than 10% of city hospitals are actually following transparency regulations created by the federal government. City unions taking their plea public.
My kids go to public school. I'm worried if the city keeps overpaying for healthcare costs, they'll have to cut services my family counts on.
We love our hospitals.
I love my hospital.
But high prices are out of control.
And so not only are these skyrocketing prices a concern for each of us individually as we seek out hospital care, but as taxpayers overall, because we're footing the bill for all of the city workers. That's why they say we have to get these prices under control. In New Hampshire, they started doing this about a decade and a half ago. They've seen some prices drop by 5%, which is an interesting move considering how much healthcare prices overall have risen due to inflation.